before we talk about vaccines, we should know the structure of SARS-CoV-2. And the most important component in this structure is the presence of the spike protein. This you can see the spikes which are there, which are very typical of the coronavirus, and the spike protein, because most of the vaccines, they're basically targeting the spike protein. That is the most important component of the vaccine would be some part of the spike protein, so that this spike protein, when it is introduced or when it is injected into a person, it will initiate an immune response. And once the immune response has been initiated against the spike protein, this would be able to counteract the viral attack. And most of the mutations which are occurring, even with this latest Omicron variant, most of the mutations, they've occurred in the spike protein. So the spike protein is basically a triacyl transmembrane glycoprotein. And this is composed of two parts, basically S1 and S2. So S1 is for attachment to the cellular receptors in the host cells. And S2 is responsible for fusion between the viral cell membrane and the host cell membrane. Then there's another component, which is the hemagglutinin esterase dimer, which you can see here. The hemagglutinin esterase dimer, again, this is for attaching to the sialic acid component of the glycoproteins present in the host cells. Then you have a membrane protein, which is the most abundant structural protein. So this membrane protein, this basically gives structure to the virus. And this may not be very important either for the multiplication or for the pathogenesis, but it is a structural component. Then there is this envelope protein, which is basically a transmembrane channel, ion channel, through which the transportation may occur. And again, this is more important for pathogenesis. Plus, you have the nucleic acid protein and RNA, and this is basically for tethering the nucleic acid component